perspective, I would like to have Spencer's problems in Korea or Naoto's problems in Japan. I think we have more problems on the scope of Ben Luz in South Africa. And also the Indian talk was pretty close of the reality we live. Yeah, I think in contrast to India, I think our one benefit is that we have very good relations now between countries in Latin America. So traveling is not an issue. We are friends in general, and we support each other as good as we can. So from that side, that is really a very nice atmosphere, I would say. Yeah. What can I say? I stick to the questions. So first of all, our status quo. How would I describe Chile? Yeah, and Chile has had a long row of steady growth, steady economic growth, starting in the 1990s when it turned to democracy, and has been developing very nicely, I would say, until 2017, more or less. And then a nice drive session, a long drive session, sort of got bumpy. For about 10 years, 12 years, there has been investment, state investment, very good plant in microscopy and other advanced equipment. We have the Fondekip line, and Chile has, and here's a link also from the slide if you want to check, more or less 40 optical and electron microscopes along the country. No, Chile is long, not wide. Yeah, and they are grouped in several facilities of different size, of course. And Chile is a very centered country. A lot of science happens in Santiago. In our facility, we have 10, 12 microscopes. In the University of Chile, around 15. Then probably comes the Catholic University, that was the second largest facility, and the University of Bio. Yeah, in the scale of 5 to 10 microscopes. No? And that's more or less the standard size of our facilities. And there are some others. I cannot name all of them, but smaller. No? But also good, very good and excellent scientific quality. So in summary, no national imaging strategy on a broader perspective, like the ones we have seen in Europe, France, UK, Argentina also. So I was happy to see that our colleagues from Uruguay put us on the upper list of organization. I'm not sure that we are there, but on the second level probably. Yeah, we're not having organized a National Scientific Imaging Society yet, no? And there's an incipient society of specialists in advanced scientific equipment, no? That is evolving. Yeah, that is how our web pages look like. Very similar, I would say, in the units. Yeah, we have offer services. This is the first example of our facility at the northern campus of the University of Chile. We have started to build. We were slow in the last 2 to 3 years, of course, with facility and opening new spaces. It's been brutally paced down by COVID and other occurrences. But we have now these co-working space that have to be filled again with people now. And we are pretty good in live imaging. So our microscopes, and I just show here on the right, a 4-lens light sheet microscope. And in perspective, what our Indian colleagues said, one experiment there is taking like 10 terabytes more or less. No? So this is really data already in live imaging. So our issues, our problem is to evolve in an organized manner to do really facility work, to be fluent in how we manage the facility, how we do recover the paying, how we organize internally. No? And that was a lack of investment in many centers. And we're now applying for grants so that we can really put a professional management on top of our more investigator-driven forces, to build rings of equipment. So that's what we are presently working on. Also, the state is starting to invest now this year in state networks. We have sent a grant also to build a state university network in digital health. It is also related to imaging. No? And then, yeah, everybody has mentioned already the Chan Zuckerberg initiative, where many groups, I guess, from Chile have applied this time, and that is probably good. And everybody's waiting what will happen. No, but these are nice points. Okay, what happened in the last 1.5 years? I would, from the Chilean perspective, directly say this is at least 2 years, because something has happened in Chile that is not happening in all of the world. No, we had a huge social riot, and that started just the week that I have been having lunch, no, with my colleagues from Uruguay the last time, like 2 years ago in October 2019, no, with Andreas and Leonel. And we left our course, our international imaging course on microbiology. We took the next plane and just flew home, no, because yeah, buses were burned, and we got into really troublesome social situation. And that was pretty violent at the beginning. But then when it sedimented down, it became slowly more peaceful, and it was clear that the issue was about here equity, accessibility, participation, transparency, and quality on a social level. No? And these are more or less also the keywords we use when we try to describe our maturity status within our facility and university work. No? So they are very nice parallel. That's with how mature are we in sharing data, open or not? How do we conceptualize our work at the beginning? No, what are we working for? This is especially important in health. No, what is the center of what I do? It's not only techniques. Yeah, and that popped up, and we are now writing on a new constitution, no, to define these very basic values. No? And this is really a daily business. Yeah, then we summarized, I think this year, beginning this year, no, the paper that was led by Jason here. What is in our view, how do we see each other in the global perspective? You can just read the paper and summarize what you saw already. South American is diverse, just as Africa. And the big issue for us is funding and maturity, but first of all, funding. No, we don't have a big problem also with our new academics. No, we have cannot give a perspective, a solid perspective for young, talented investigators in the last years. No, and then COVID dropped in. No, and the mass demonstrations obviously a super spreader event for COVID, so it hit us pretty hard at the beginning. And I just wanted to cite also our president of the Chilean Academy for Science, just summarizing also, no, state support for science has been shameful, and she's not using the word shameful too much. No, she really thinks before saying that, and the country aspires, no, the country needs a different funding. So the number what we spent in science is 0.2% of the gross product, no. Government says 3-4, but then you can see private public money, no, but it dropped from almost 0.4 in the last 2 years, and that is a lot. No, and she said it's almost zero is nothing. No, and that's how we feel. No? So we need funding to be robust, to start maturing. No, and you need people. Yeah. But the summary here, what are the negative points, mixing the social situation with the COVID situation? Obviously, biomedical imaging has been very difficult. Our laboratories were closed for quite a long time. Limited access to laboratories, microscope facilities. Students have to reorganize their works. Many of them are late. We are trying to do our best. But the benefits and the nice things are that we have become completely digital also, that all our courses are digital. We have tutorials, a little bit what our colleague from Japan showed, but on a different level. No, this is the desktop from Veronika Eisner, no, my colleague from the Catholic University. And yeah, we have all the technique concentrated on a small space. But we didn't lose contact to the students. We didn't miss a semester. No? So that was really good. And the students pushed also, no? And all the colleagues pushed. Tremendous work, really, really good. So biggest opportunities, most important developments, what do I see? Yeah, first of all, I would like to come back to 2019 when we had the meetings. No, we had quite a pace to see innovation, how innovation in the country can be fostered by also facilities. No, there are many opportunities, I would say, but the maturity within the country still to foster innovation, to have capital, no, to like spending in ideas and to be adoptive for innovation has to be established. No, people like to buy things from outside, but still there's not so much innovation that is coming within the country. It's popping up, but it needs a new form to negotiate with skills, with institutionality. The fundings has to be there and the culture has to be developed. No, I'm not saying anything new, but that needs time. No, and that needs to be very. We need to be very consistent on that. Then I just put screenshots on my last slide or almost last slide. No, Korea. We are sharing, no, and seeing the opportunities in bioimaging informatics. No, I'm leading medical informatics also, so I'm a little shifted from the bioimaging part more to the medical imaging part also in the last years. So this is a huge opportunity. Hospitals are now much more open to adopt digital techniques, no, telemedicine, and that is really a good thing. Image data management sharing. Yes, no, nobody likes to share. That's a cultural issue, and that has to be motivated. Yeah, all what was so said in the Indian perspective, we share that, no, and we are especially working on also on patient data, on giving the confidence that we are doing good work, and also to the confidence to open up, no, and build trust with our partners, no, because trust is really valuable. Yeah, and now, yes, thank you. So what I try to maybe add, we're really trying to do all we can. We work with the national funding, with the state funding, with international funding, and also in the last 2 years, the private people came in. Roche, Atris, ITMS, no, now Chan, Zuckerberg also are new sources that we haven't seen so much before. So we are trying to do the best with all of that in that mix, still learning, also careful of what we do, because not everything that is new is good. We have to see how that evolves, no, and how that is negotiated in the context. But fine, still with a lot of energy, I would say, and happy to explore, no, and there's so much room to grow. So that has to be the starting point, no? But still a lot of work that has to be done. So with that, I would just close and thank you for your attention.